age group of kids is now eligible to receive Pfizer's booster shot for COVID-19. Here to answer your questions is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Thanks for being here, Dr. Moffitt.
Sure, good to see you.
All right, a lot to ask you about today, Dr. Moffitt, but let's start with booster shots. There was significant debate among the experts yesterday about whether kids who are aged 12 to 15 actually need them. But the CDC panel ultimately decided to recommend them, and late last night, the CDC director agreed. So do you believe that's the right decision for that age group?
I do. I really do. And that is especially my belief because of this unbelievably contagious Omicron variant. We know that boosters can have an impact on the likelihood of someone becoming infected with the Omicron variant. So being able to boost 12 to 15-year-olds and potentially prevent infections in those 12 to 15-year-olds will have not just a benefit to that boosted individual by allowing them to miss out on what even may be a mild infection, but they get to stay in school. But importantly, too, for the people around them, it could protect those individuals by making that 12 to 15-year-old less likely to infect someone else.
So clearly you have concerns about Omicron, and the other big headline this week, a record number of children in the U.S. now hospitalized with COVID, most likely tied to that variant. So what can you tell us about the situation right now at Children's?
Yeah, we are absolutely feeling what children's hospitals and hospitals around the country are feeling in terms of a real surge with COVID patients right now. There are currently 42 COVID-infected patients admitted at Boston Children's Hospital. It is true that some of those were identified as COVID-infected through screening as protocol for being admitted to the hospital for a reason unrelated to COVID infection, but many of those are being admitted for COVID-related complications. Typically, that means that it is a child who's requiring oxygen or some degree of respiratory support or hydration to get them through this illness. And so we are feeling that here at Children's as well.
Well, on that note, some pediatricians say that the Omicron variant might be more dangerous for the youngest kids, the kids that are under the age of 5. Of course, that age group still does not have access to a vaccine yet. So what are you seeing with your patients in that youngest age group, and what would you want those parents to know? Because they're probably questioning anything they're able to do at this point.
Yeah, no, I think it still remains to be seen whether or not Omicron is causing more severe infection in kids under the age of 5 because of something unique about Omicron in that age range, or whether this is really typical of what we see with respiratory viral infections in younger children, which is that they are more likely to require hospital-level support. And that's for a few reasons. It's because of their more immature immune systems. It's also because of their just physically narrower, smaller airways. A respiratory viral infection is more likely to tip them into needing some support for oxygenation or some hydration support. It may, though, well be that their inability to be vaccinated yet is contributing because they have not had the benefit of the vaccine-mediated protection against severe infection. So I think we still need to kind of tease some of those things out. What I would recommend to families with children in that age range is just keep doing more of the same, having everybody in your household, everyone who that child spends time with, as vaccinated as they possibly can be to ideally prevent infection or reduce infection in the circle of people around those young children, and being extra careful when we're leaving our house and spending time, particularly indoors right now. Masking up, hand hygiene, really being fastidious about that.
Okay, Dr. Kristen Moffitt from Boston Children's Hospital, thanks as always for being here with us.